Hello, we are moving on and completing our assessment of insomnia. Well, what may be obvious to us as professionals may not be to family and caregivers, and that's that the patient is experiencing some underlying symptoms such as pain, difficulty breathing, or nausea. All of these symptoms can cause a patient to awaken or keep them from going to sleep. They must be attended to, and hopefully even before or at the same time the insomnia is being addressed. Remember, in the patient with dementia or Alzheimer's, they often cannot verbalize their experience, so their behaviors must be observed for understanding what is happening. A restless or agitated dementia patient may be really uncomfortable or painful but can't recognize it or verbalize it, so make sure to alleviate pain. And let's assume that physical symptoms are being managed and get back to insomnia. Perhaps there may be a psychosocial reason for the insomnia. Does the patient have a history of depression even before hospice? It would certainly be not uncommon for a hospice patient to be troubled by underlying depression due to their diagnosis and change in their lifestyle. They may also have problems with anxiety or have unmet spiritual or emotional needs. Are worries causing them to perseverate about a problem or pop up into their mind as soon as they awaken and prevent sleep from returning? These may be existential concerns, fear of death, and worry about an afterlife. Bring in your social worker and your chaplain to address these issues. Perhaps, and often in hospice, there has been a change in the patient's home setting. They've had to move to a different place or facility to receive a higher level of care. There's still a couple things to discover. Is the patient on a medication that can cause overstimulation, such as a steroid, anticholinergic? What if they were started on a steroid and didn't understand or get clear instructions and are taking it late in the evening? So, as an aside right now, it's always important to have those steroids taken in the morning, no later than 2 o'clock is our rule. What about the use of stimulants during the day, such as caffeine, coffee, nicotine? Are they sipping on Coke or Pepsi? Even chocolate can inhibit sleep. Has anything changed lately? If the patient has dementia or Alzheimer's, has there been an onset of sundowner syndromes in the late afternoon, restlessness, agitation that reaches into the early evening? And one last item in the assessment. Has the patient had or currently have a sleep ritual? What have they always done to get ready themselves for sleep, and has it been interrupted? Okay, we finally have a very clear picture of the goal, the pattern, the recent changes in medications, lifestyle, emergence of new symptoms. Everything we have touched upon influences sleep patterns. May I just make this note to you hospice professionals? Are you seeing that and understanding and taking a very full and complete assessment of each problem we discuss? That actually the treatment and alleviation of the problem arises organically out of that thorough review of the problem and can often be resolved during the assessment. In the next video, we're going to explore interventions to review that problem and get rid of it. Please pick up your copy of our booklet at the website. Don't forget our blog. Make comments and questions. That's how we know what more information and support you need. Please subscribe to our YouTube channel, The Hospice Care Plan, and remember, Brenda and I are the Care Queens because our motto is care is treatment.